So this is a 1 year follow-up after quite extensive surgery. After that olive procedure that we did about a year ago, and obviously our surgery was L3 to S1, so 3 level. And but tell me, what were your symptoms before?
I had a lot of leg pain,
1 to 10, how bad was the leg pain?
7, 8.
Okay, how bad is the leg pain now?
I don't have any leg pain now.
Good, good. Now, so how long did you have the leg pain, and what happened before that? Tell me about it.
Well, I had my first leg pain came on like in 2003,
Okay.
and I had surgery about a year after that.
So they did just decompress. They didn't fuse it. Okay.
Just compression
Yeah.
and laminectomy on one level. Then I think in 2010 or so, I got pain back, and it was excruciating pain in both legs. And I went in and they did a triple laminectomy.
Yeah, they did another laminectomy. Okay.
And then the pain wasn't so bad for a while, and then about a year before I had surgery, I started getting some pain, and it kept
Well,
getting
yeah.
gradually worse.
Can you explain where the pain was and how bad it was?
The pain was in the worst pain was in the left leg, and it would go down the side of my leg down towards my bottom of my calf.
Okay. You know, many times when we do a surgery like laminectomy, that I see here that the back of the bone is missing, that's a laminectomy. That bone is there for a reason. When we take it off, sometimes actually spine becomes weaker. So it's not unusual for people who have a laminectomy, same level the disc failed, and then what you got is practically more definitive kind of procedure, making sure that we strengthen the back by making the bone growing together. So
I've told many people that I felt like the laminectomy surgeries were just a band-aid.
In a way, you know, we sort of taking the bone away, making the spine weaker.
Right, because it narrows the vertebrae.
Yeah, because to open up the back of the bone, but many times it works. For many people, at least temporarily it works, but in many cases it's not a more definitive procedure as a fusion that we did for you. So, but the results so far are sustained, meaning that how is your daily activity? You told me that only one time you had pain. Can you describe that to me again one more time?
The pain that I've had, and it's a phantom pain, it comes and goes. It's on the front of my leg from above my knee, leading up towards my thigh. And it's almost a numbness in there.
Yeah. But you said there was some activity that provoked that pain, right?
Oh, yeah, that pain is a phantom pain from the nerves. My wife rearranged the living room and moved the television, so for me to watch it, I had to kind of twist to the left. And after a very short few days, my pain was in my back.
Yeah.
And,
So twisting.
right, twisting, turning.
Yeah. And that is why we say BLT. Bending, lifting, twisting. Don't do that.
Right.
Yeah. So that's but overall, are you back to your basic activities? And
100%.
How do you feel about this surgery that we did about a year ago so far?
I am glad I had it. I don't have to live in the pain anymore.
Good.
I feel this is a more permanent repair than the band-aid jobs I had in the past.
And the study, the data support you with that. That seems to be more sustained kind of result that we have with this kind of surgery. But overall, that pain that you said it was up to 8, and so that is gone, right?
That is gone. That is gone.
Okay.
And I'm really glad I had the procedure that I had with that you do, because I know that the other one I'd have been laid up for months.
For months, at
I
least.
actually was back to work light duty in 2 weeks.
In 2 weeks, excellent.
With a brace.
Yeah, obviously. What kind of work do you do?
I work for a road construction company, and I drive a CDL.
That is a heavy job, and you were back to that within 2 weeks. That is after open surgery. That's unheard of. That is unheard of for somebody after open surgery with a 3-level fusion, going back to work within 2 weeks. So you're a proof that this surgery put people back on their life much faster and much more efficient.
By far.
Excellent. Well, thank you so much for the interview. I appreciate that.